Good
Here we are.
afternoon. How
Good
are you?
afternoon. Board's
Beautiful
all
day.
yours.
Yeah, okay. I'll just do a little update. As of this morning, we have 1,074 cases. If you look on the OHA website, you'll notice that we've only had 6 positive cases in the last week. Yay. Right now, we're only monitoring 6 active cases. So that is quite a diminishment for us, which is great. We've had 34 total hospitalizations and 29 deaths. Right now, we have a couple of cases that are persons under monitoring that aren't actually positive cases, but we treat them as such. They are a high risk folks that come from an area of large outbreaks, and so we're monitoring them for 14 days. We have 2 that will be graduating tomorrow and a 3rd by the end of the week. So our monitoring will be way down as well. We have given a total of just under 4,000 vaccines through the county health department and shared much more with our partners. I know that we sent the letter to the state, and I know that they received it because I got an email back. But I did want to let you know that it looks like starting March 29th, we will be receiving a significantly higher number of vaccines on a regular basis. The state is suggesting that we'll get about 2,000 doses a week starting the last week of this month. And it looks like out of that, 400 doses will be going directly to pharmacies in the area, and 350 or so doses will be going directly to One Community Health to address those high risk populations that they are responsible for vaccinating. So right now we're still working in group number 6, which includes adults over the age of 65. We are we're doing pretty well, and I think that Darren might have some updated numbers for us on percentages, possibly.
I included those in the weekly situational report on Friday too. I can pull those up in the meantime.
Yes. So starting on March 29th, we will be expanding the eligibility to include adults over the age of 45 with chronic health conditions or specific underlying conditions. It will also include migrant and seasonal farm workers and other agriculture and seafood workers, people living in low-income senior housing, and congregate and independent living for the senior groups, as well as wildland forest firefighters. So we are looking at quite a big increase in demand in the next few weeks, and looking forward to getting more vaccine. We do have a plan to continue to share that vaccine with our community partners, including primary care providers, pharmacies if they need it, and One Community Health to make sure that we're reaching those hard to get populations. We're continuing to use Heart of Hospice to help us reach those folks that are homebound and also that have caregivers in the home. So that is a group that we've been doing extremely well on. And if you're not aware, Dr. Van Tilburg did testify this afternoon to the state legislature about how we have strategized, and we are the highest county in the state for those individuals with developmental and disabilities, for the highest percentage of completed folks in that category are in Hood River County. So that's very exciting for us to be recognized in that way. Does anybody have any questions?
Trish, could you told us how many vaccines we're expecting as of, I think, the week of March 29th. What are we receiving now on a typical week?
Somewhere between around 500 doses a week.
Oh, so this is, and you said 2,000 or 1,900? I forgot the number.
Around 2,000. Well, they said 1,950 doses, but it'll either be 1,900 or 2,000. They only ship in multiples of 100. So
it's 3 to 4 times what we've been seeing. Is that correct? And so does that mean, are there other sources that aren't being captured through that number? Does vaccine come in any other pathway that you're not reporting on?
Providence has gotten some in the past. I'd have to look back to see how much they've gotten. I do get that report on a weekly basis.
Okay, but we're going to see a significant increase. And are you comfortable? Is there a plan, I should say? Is there a plan in place, or when do you plan to have a plan in place for how to step up the clinics and that sort of thing? Yeah, it sounds like you've got a little bit of warning now.
Yeah, we've got a plan. We've got a plan, and we're actually putting it on paper. Oregon Health Authority wants to know what we're planning on doing, but we are planning on providing at least one large clinic a week from the health department, and then also providing our partners with more vaccine. We're talking about doing high throughput clinics in the mid and upper valley starting in April and May. And as soon as we have the ability to do that, we will be putting that into motion.
Can you share that plan with us when it's ready?
Yes.
Thank you.
I'd be glad to.
Darren, did you have anything to add?
Yes, thank you. If I can just circle back to when Trish mentioned the numbers, I just peeked back at as of late last week, we have 50% of our 65 plus population vaccinated compared to about 43% of the state overall. So as of last week, we were the 6th highest county in Oregon. So it was a big jump, and there was a big jump from the week before prior. So it's nice to see what we do day to day actually come out in the numbers too. That's exciting.
Jeff, we had a letter from Oregon Health Authority, I believe. Is that right, Trish? That we sent them a letter, and they've gotten in contact with us and want to meet with a group, including Trish and Darren and Jeff, and they wanted a commissioner on that. Jeff, is this a good time to decide how we should do that, if one of the commissioners are willing to be on that, or later?
This is fine, or you can do it later, whichever is the pleasure of the board.
We seem to have time. They wanted one of the commissioners to be on, and I wanted to have the meeting so we decide who to be on that. How do I say this? Karen, you've been our real health specialist. Would you like to be on that?
I was going to nominate her.
Sure, I'll do that. But I guess my question is, what is the premise of the meeting? What's it for?
Trish?
It's to talk about vaccine supply. I think what's going to happen is they'll tell us again that, you know, it's going to be opening up in the next 2 weeks. They're expecting to see large amounts become available to all the states, and therefore the counties are all going to benefit. That's just a guess, but that's pretty much what I think they're going to say.
The way that I read it, the way that I read it, they took our letter to say that we didn't think we were getting our fair share, and I think they're going to tell us that we are getting our fair share.
Okay, that's fine. Happy to do that.
Thank you, Karen.
Well, I have to say, in reading about other states and the distribution issues to rural communities, I feel like Oregon's done a pretty good job compared to some of the other states in having parity for rural communities.
Yeah, you know, this is a sort of a fascinating thing because everyone has an anecdote where they know someone who got a vaccine who they don't understand why they got a vaccine, so therefore the whole thing is messed up. And I get that, but the reality is it's not. Those just aren't typical, and there's probably something you don't know about that person, and it's really none of your business. And I mean, I really feel for Darren, you know, and for Trish being in this communication business, where everyone has a suspicion that someone got in line ahead of them that doesn't belong there.
We really saw that come to a head after we started immunizing caregivers to people in their families, and people not understanding that, you know, we don't, you know, it's not everybody's business why somebody is allowed to get a vaccine, but there are reasons for it. So we've been really pretty good about making sure that people fit into the groups that they fit into. It's going to be harder as we go along, and it'll be a blessing when we don't have to screen people anymore, when we can just allow them to schedule vaccine. And the president says that'll be May 1st, but I don't know. We'll see how the vaccine supply is at that time.
I would suspect he knows more than we do, so at least
I hope so.
I'd just like to say thanks for letting. They were nice. Trish and Darren and Belinda got me lined up. They were nice enough to let me volunteer a couple weeks ago at a clinic, and it was. I thought it went incredibly smooth. I mean, I'll just echo the comments that the other commissioners have had that have done it, and just really incredible. I mean, there was a little issue at one point where folks were backing up outside, and that was resolved very quickly. I was really impressed with how all of that went, and you know, I have full confidence that that your plan to increase the vaccinations, you know, if it worked anything like that did up to this point, I think it'll be excellent. So I have a lot of faith in you all getting it done.
Yes, thank you. It is a scalable model, and it is something we can really, it doesn't feel like we're working at full capacity. It feels like we could add quite a bit to that. Yeah.
I will make a comment that I think when we get into the farm workers, it's going to be a little bit more problematic because it's a little more difficult with language and culture, and they don't want to get a shot and things like that. But I'm looking forward to getting into that system and helping as much as I can from out here in the orchards. So let me know anything I can do.
Thank you. We are going to be working with our partners around that messaging as well. So we'll be getting ready. We're gearing up for that now.
Mike and Bob, do you have any visibility yet into kind of how it's going to work for the workers that you folks work with? Have you been led into discussions on that subject?
I've been thinking about it, but I haven't had any conversations with the health department or One Community Health or anything about it yet. No, I haven't.
No, I really haven't either. The one thing we have seen is that there's a lot of information being pushed out, and a lot of trying to make that population comfortable and willing to come in and get a shot, because that's the biggest concern, I think. I think the process of getting them through the event is one thing, but I think it's just getting them to show up. And so I know that there is some efforts that are out there that are trying to address that portion.
Yes, and One Community Health will be doing some visits to some farms and doing some coordinated efforts. If you're not aware, One Community Health is working on a pilot project with other FQHCs around the state, and they will be able to start providing vaccines to that group early.
Trish, are you expecting more Johnson & Johnson that you can bring to a location as opposed to the stuff you're getting now that you have to do in a specific clinic?
We're hoping. We don't know yet, and the state does not know at this point what the allocations are going to look like. So we'll just have to wait and see. We should have a couple of weeks lead time because the state can actually see into the ordering process, and they should be able to by midweek this week to know what we'll start to get in the next 3 weeks. So I think we'll know more by midweek this week.
Great. Again, this is something that people keep asking us about. So if you can just keep on passing the information along, that lets us help keep people informed.
We will do that.